This evening's event is sponsored by the healthcare team and the civil liberties team of the Larimer County League of Women Voters, the Loveland chapter of the American Association of University Women, and the Citizens Advisory Committee for Mental Health Matters. This is the third time the citizens-led initiative has been tried to increase resources in Larimer County to better serve the people who suffer from mental health issues or addiction. It was tried in 2008 and again in 2016. In 2016, we came close, but the ballot initiative failed by a few percentage points. Why are citizen groups so persistent to add additional resources to Larimer County? Because everyone knows someone who has experienced mental illness and/or addiction. About 1 in 5, or 54,000 adults in Larimer County, has a mental health concern, and 20% of the youth ages 13 to 18 have expressed concern about their own mental health. Because about 1 in 10 Larimer County adults, or 26,000, are dependent on alcohol or other drugs, and many adults have both a mental illness and a substance use disorder. Why the persistence? Why do we keep trying? Because just about everyone knows a family member, friend, neighbor, or coworker who are using drugs to self-medicate their mental illness or emotional crises. Why are citizen groups so persistent to add additional resources to Larimer County? Because when people with mental health and/or substance use problems, if they do not get the treatment that are needed, there are many severe and possible consequences, including suicide, criminal justice, family crisis, job loss, homelessness, and a deteriorating physical health. Why the persistence, you may ask? Because in 2017, 75 Larimer County residents died by suicide. There were 53 overdose deaths in that same year. Why the persistence? Because Larimer County has a much higher suicide rate than the Colorado average or the national average. Because 70% of those who died by suicide did not seek mental health treatment. Why the persistence? Because we know that mental illness and substance abuse disorders are brain diseases, and we should address these diseases just as we do other chronic illnesses, such as heart disease, diabetes, cancer, or dementia. Because the ballot initiative is an appropriate response to public health crisis. It is also the best economic approach. A California study found upwards of $7 was saved for every dollar spent on mental health or addictions treatment. A Kaiser Permanente study of Northern California analyzed the average medical costs during 18 months of substance abuse users. Those who were in treatment, we found out that 35% had a reduction in their inpatient costs, 39% reduction in emergency department costs, and a 26% reduction in total medical costs compared to the substance abusers who did not receive any services. So again, you ask, why the persistent? Why are you trying again? Because in 2017, Loveland police picked up 46 people who were too impaired by alcohol or drugs to be left alone. The police officers picked up these people, took them to the emergency room where they were medically cleared, and then they were transported to Greeley for detox. Wouldn't it make much more sense to have a substance use withdrawal program here in Larimer County and avoid the very expensive hospital and transportation costs? Why the persistence? Because we know people can and do recover with the right continuum of care and the needed wraparound services. We listened to the people who voted against this initiative in 2016 and have made some significant changes. The focus now is not on the building. We've changed from a 25-year tax to a 20-year sunset. And we have made it clear that resources will be used to support and enhance existing programs and not start new services unless we identify a major gap in those services. And services will be evidence-based. We know that those services will work. The county will administer but not be a service provider. The proposed tax is 25 cents on $100. Now let me introduce the panel members. Gary Darling is here to provide the data. He is currently the Criminal Justice Service Director for Larimer County. Has had 30 years of Larimer County Sheriff's Office experience, including 17 years as a division commander. Gary has served on the Mental Health Substance Abuse Alliance Steering Committee since 2001, and currently he oversees the county's community corrections. Mary Maldonado is a NAMI member and is a passionate community advocate for mental health, substance abuse, and children's wellness. Curtis Royer is a licensed professional counselor and is a certified addictions counselor. Curtis has 27 years experience as a substance abuse counselor and 19 years as a mental health therapist. He specializes in treating the dual diagnosed client. Kathy Wright is best known as a recently retired executive director for the Boys and Girls Club of Larimer County. In November of 2017, Kathy was elected to the Loveland City Council. And it is especially important to note that Kathy is the mom to Joe, age 26. They have grown significantly through dealing with Joe's bipolar disorder, heroin addiction, and their recovery process. And Jeff C. Jensen has been a resident of Larimer County since 1974. He attended Thompson Valley High School, the Colorado State University, and has been politically active for the past 15 years, serving on the Larimer County Republican Board. He is the owner of Jeff C. Jensen Consulting, specializing in political and business consulting. Jeff has served and is currently the chair of the Larimer County Planning Commission.
In the 1980s, I was assistant jail commander at the Larimer County Jail. But one of the things that was really a problem for jail commanders during that whole time, from '86 to when I left in 2007, if you ask any jail commander in the United States, they'll tell you the number one problem that they have is dealing with people with mental health issues. That continues to grow. When I was at the jail and I left in 2007, we were averaging about 18, sometimes 22% of the jail population having a mental health diagnosis. In the 1960s, mid-60s, the United States decided to decentralize or deinstitutionalize mental health facilities. At that time, there was about 350,000 people in institutions in the United States that had mental health issues, and about 50,000 people with mental health issues in jails. In the late 1990s, early 2000s, there was about 50,000 people left in institutions in the United States that had mental health issues, and about 410,000 with mental health issues in jails. So you can see that didn't work very well. There was supposed to be a mental health facility in communities for about every 100,000 people. There was supposed to be something for them to get care. That was never financed. It never happened. So here we are. In 2016, the average jail population here in Larimer County was 545. And I'm using 2016 data because it's tied to recidivism rates. And when we look at recidivism rates, we have to look back a year. So we won't know 17 until 18 is over. So that's why I'm talking about 16. Of the average 545 people in the jail, 51% of them had a mental health self-reported diagnosis. 45% had a dual diagnosis, meaning alcohol, some other substance, plus a mental health issue. And you combine all of them, 86% of them had a substance use disorder. So almost everybody who's been in the jail has something going on, and most of the time, not good. And it's really hard to deal with it. The one-year recidivism rate for people that have a diagnosis, 1 year, the recidivism rate is 10% higher than people without an issue. And we're talking 22, 23% for everybody else. We're talking 33, 34% for these other folks. Fred touched on what it cost for treatment outside outpatient treatment, let's say $4 to $7 a day, something like that, depending on what it is, and medication, I guess. That's pretty good since it costs $118 a day to hold somebody in the jail. And many times people are held in the jail because there's really sometimes no other place to put them. In 2014 really is when the marijuana became legal in the United States, or in Colorado. And that year we had 585 felony drug charges filed in district court in Larimer County, 585. In 2015 there was 1,116. And in 2017 it grew to just under 2,000. This year, right now we have almost identical what we had the whole year of 2016. And so we're going to be over 2,500 felony charged cases of felony drugs in Larimer County. One of the big issues that we're running into with law enforcement is they're carrying Narcan, and some of them help people who have overdosed on opioids. But recently there was an incident in the jail. Somebody was booked into the jail. They have what had apparently at least residue of fentanyl. One of the people that work in the jail got overdosed immediately. They had used Narcan on the officer, or I'm not sure if it was an officer or civilian. They had to go to the hospital because of the drug, which fentanyl can go through the skin. So they don't have to take it. They just searched somebody, got it on them. That was it. We talk about detox, having to take people to detox. When I first started the sheriff's office, we had 2 people. That's all they did. They just transported people to detox back and forth. Now we have a contract that does that as long as they aren't full. Unfortunately, they're full oftentimes over in Greeley, so we can't get Larimer County folks in detox, which causes a problem in that the officer who has somebody who needs detox, they have to take them to the emergency department, get evaluated. Sometimes they have to wait around, sometimes they can go, but it is time consuming. When they can get them into the jail, there's really 2 ways. If they're really combative, too combative for the emergency department, they'll take them to the jail. Or they'll add some charges on them and they can get them into the jail that way. But that's probably not the best use of things. They could be diverted in many cases. Fred already talked about the numbers of people in Larimer County. I will tell you that the jails and the emergency departments do a very good job of stabilizing people. They do an excellent job of taking care of people. So the problem is if they get a prescription for Suboxone or something like that, is that Suboxone has a street value and they can sell it if they have an addiction, so that's not always the best thing to do either. And then we try to, the continuum of care, try to keep people in services when they get released from the jail. It's not always possible, but the county has a contract with Summit Stone for about $80,000 to tie people to services. I do want to touch on the fact that we also have a wellness court and another mental health program. The county, between those 2 programs, is putting in about $750,000 a year for those 2 programs. That's a wellness court is a mental health court. So we are doing that. We also have a DUI court and a drug court that's been around since 2001. There's about 60 people in that. We have in mental health court, wellness court, and the AIM program, we have 70 people. And with DUI court, we have about 40. So we are doing some things. Thank you.
Okay, thank you. My name is Mary Maldonado. I'm a NAMI member, the National Alliance on Mental Illness, and I also participate in the Grand Family Coalition for Grandparents or Kinship Raising Kin. And then I'm also involved with the Namaqua Center for Grandparents Raising Grandkids, and I'm a community member who loves to talk about mental illness with anybody and everybody that will listen to me. Because I feel that having a facility in Larimer County is very, very important, especially because there are so many children that are being raised by a family member who has a diagnosis of depression, separation anxiety, ADHD, adjustment disorder, and Summit Stone is wonderful. I love Summit Stone because they do very well with children and with adults too, but we need more. We need a place where you can have education. When your child is diagnosed with ADHD, okay, what is ADHD? Where do I go from here? How do I know what to do to help my child with ADHD? How do I help myself not to get frustrated with my child that has mental illness? And then I myself have been diagnosed with major depression, reoccurring, post-traumatic stress disorder, and anxiety. And I have also have to deal with my children, my grandchildren, and some family members that have a drug addiction problem, that have an alcohol problem, that have mental illness as well. And sometimes they don't want to go somewhere because they say, no one's going to listen to me, or they're going to lock me up and throw away the key. I try to talk to them and explain to them that mental illness is an illness like any other type of illness. And I always use diabetes. I always say everybody has sugar in their body. If you have too much sugar, you have diabetes. You have to take medication or insulin. If you don't have enough sugar, you have an illness, a hypoglycemia, or can't remember what it's called. You have to take medication. You have to take care of yourself. They send you to classes on what you should eat and how to check yourself for to take your medication for diabetes. So I tell people, we all have these beautiful minds, and sometimes our chemicals are too much, so we have a mental illness. Or sometimes we don't have enough chemicals, and you have a mental illness. But then, where do we go? Who explains to us what exactly is happening to us? How do we deal with it? Who can we go talk to? What's the next step? We should have something here in Larimer County that will help us the way there's a heart center. If you have a heart problem, you go to the heart center, and then they take you step by step on how to take care of yourself. You have a diabetes center. You have a cancer center. Well, we need a mental health center that will walk you through from the minute you're diagnosed up until what you need to do to take care of yourself. And it affects all the family, because some families don't understand what a mental illness, and if you try to explain to them, it's hard for them to understand unless they have had to be with someone that has a mental illness and they have to deal with that person, or they themselves are going through something, but they don't want to admit it. They don't want to talk to somebody. And I'm also concerned about the Spanish-speaking community. And I say Spanish-speaking because there's a variety. There's Mexicans, Spaniards, Puerto Ricans, Cubans. You can't lump them up to just one thing, so I say Spanish-speaking community. They need help as well. But sometimes there aren't enough people that can speak the language to help them. And sometimes they don't want to come out because they don't know if they'll be accepted. If they're documented or not documented, they're afraid that something will go wrong. Mental health is very important. Your mind and your heart are the two most important organs in your body, because your mind cannot work without your heart. Your heart cannot work without your mind, because they need to speak to each other. They tell each other what to do. They tell each other what to say. And if your mind's not working well, then you don't make good decisions. And people shouldn't have to go to jail or shouldn't have to be in drug court in order to get the help that they need. It should be avoided, because who wants to have a criminal charge on their record for a job or to rent, and they want to have the help before it gets to that point. We need to make sure that our children don't need to wait and go into drug court in order to get the help they need. I have a son who, he's 29 now, and back in the day, I tried to get services for him, but there was not as much as there is now, but we still need more. He had to be in drug court in order to get the assistance that he needed. And currently, He's in prison. Sadly, he is going to be in prison until his 40s. I don't want that for other kids. I don't want that for families to say, I have to wait for my child to commit a crime before they can get the help they need. We need to fix it before it gets to that point.
I'm Curtis Royer. Thank you all for coming. I think it's great that everyone came out to talk about this really important topic. I work with Dr. Glenn Pearson. He's a psychiatrist with UC Health, and I believe he was asked to come, but he's on vacation, so I'm your second choice. Just thought I'd throw that out there. So I'm a mental health and substance abuse therapist. I work for University of Colorado Health. I primarily work out of Poudre Valley Hospital emergency room on the crisis assessment team. So we see between 350, 400 patients a month in our emergency room alone for mental health and substance abuse assessments. Just this morning, or I think throughout my 8-hour shift today, I took probably 20 calls from family members looking for substance abuse treatment for their family members. It's not just an issue in Colorado. Our surrounding states and communities struggle with this issue too. My wife knows how passionate I am about this initiative. She promised me she said, you need to promise when I left the house, you don't swear. So I will do my best to control my emotions. So it's a really difficult process when people come into the emergency room. I'll give you the worst case scenario. We have one individual in our community that in the last 10 years, the last time I counted, which was over a year ago, had over 800 emergency room visits intoxicated. 99% of those he came in by ambulance. So when a person is found in the community or they call 911, an ambulance responds and fire rescue. So there are a team of people that respond to that individual. They're brought into the emergency room. A physician sees them. They're assigned a nurse. Often an EMT is part of that team. And then one of the therapists on our team will do the assessment after they're medically cleared. When it comes to detox, we have two options. North Range in Greeley, which is a social detox, and Mountain Crest is the other option. Mountain Crest is the mental health facility that's part of UC Health here it's in Fort Collins, and they're a 34-bed facility. 8 of those beds are for adolescents, so they serve ages 13 and up. So we have 26 beds left for a county of maybe 400,000 people that we need to serve. Every time we fill one of those beds with a detox patient, that takes away a bed for a mental health patient. So we have to decide, or it's generally a first come, first serve, and what the need is. Does that person need more of a medical detox, or can they go to Greeley to a social detox? When we assess that person, they get a medical workup, they get labs, we ask them if they're interested in detox. There are times where a person is incapacitated or they're also suicidal, so we put them on what's called an alcohol hold. We also, for the mental health piece, will use a mental health hold, but oftentimes it's a voluntary choice. Would you like to go to detox? Sometimes a person is so incapacitated that we can't assess them for several hours. Once we decide or we assess that person and they want to go to detox, then we have to send a referral over to North Range. They review it. They do a nurse-to-nurse consultation to be sure the person is medically stable enough to go to social detox. And then once we get acceptance, then we set up transport. So they have a transportation company that we pay for to come pick that patient up and take them to Greeley for detox. At best, it's a 6-hour process. And there are times when we have numerous patients tying up ER staff for that detox process. Oftentimes, after 6 or 8 hours, when detox transport finally gets to the emergency room, the person has sobered up enough that says, I don't want to go and I just want to leave. And then before the end of my shift, that person may be back again intoxicated, and we go through the whole process again. So the time delay in getting a person to North Range to detox is a great tax on the emergency room. So people come in with other medical needs, and our patients are the lowest priority, and they take the most time, and then oftentimes we're just going through this cycle over and over again. The worst I've seen is that one individual has been to the emergency room 4 times in a 24-hour period intoxicated. And so we struggle with being able to quickly get them to the resource that they need, having to send them out of county, and then, or if we fill in beds at Mountain Crest, then we have the mental health patients who, once Mountain Crest is full and they need an inpatient psychiatric bed, then we have to transport them to a different hospital. And most often it's Denver, sometimes Colorado Springs, and we've even had to send patients as far away as Pueblo. So it's very difficult when you tell a family, yes, I can hospitalize your loved one, we will take care of them, we are getting them into treatment, but we're sending them to a hospital in Littleton. And we don't have a choice in that. EMTALA law requires us to send that patient to a hospital that can provide that care. And the suicide rate, I know some numbers were put out. I read the coroner's report today. Between 2013 and 2017, there was 383 completed suicides in Larimer County. That's 1 every 5 days. And it's also affected my family personally. We had a suicide in our family 2 years ago. So when you're trying to meet people's needs and get them the care that they need, but we don't have it available here, or, you think 26 beds, they're always full. Oftentimes we're holding people in the emergency room, tying up services, waiting for a bed to open up so we can transport that person to a hospital. We want to keep everyone in Larimer County so their families can visit, families can be involved in their care and their treatment, which always proves to better outcomes. And sending someone to detox in Greeley, we have no control over their treatment. It's not uncommon for me to assess somebody at 1 o'clock in the afternoon that's intoxicated, call detox to see if they have a bed, and they said, well, they were discharged from detox this morning. It is not uncommon for us to experience that. So we want to have more control over a person's treatment, continuity of care, get them engaged in other services, providing the care in Larimer County, and keeping them in Larimer County not only helps the patients, but it tremendously helps the family members and using the resources that we have. So we're just trying to, with this initiative, I think it will not only, we talk a lot about money, it will save thousands of dollars, but more importantly to me is how many lives it's going to affect. Thank you.
So he said in the introduction, I'm a mom to a 26-year-old son that we've been battling bipolar disorder and heroin addiction for the last 10, 12 years. So what I thought I'd share with you is my top 10 takeaways from being a mom to Joe. Number one, that disruption of brain chemistry is not a choice or anyone's fault. Biological brain disorders happen. It's one thing I read said it's a variation of only 2 genes that cause an imbalance. Mental health care in the future will be revolutionized by genetics, but unfortunately right now we're kind of stuck. So you don't love them in spite of, but you love them in spite of, not if or because they do certain things, because they don't want it to be a part of their life either. One day my son said to me, I can never get married and have kids, or I can't have kids because I would never want to give this to someone. And that's pretty heartbreaking. Right now, we receive a costly public safety response when we need a mental health and chemical addiction center. 3, there's not enough beds. When he mentioned Pueblo, I remember sitting in the Greeley Center with a mom who was just crying so hard because her 15-year-old was going to have to go to Pueblo. She didn't have a car. She was a single mom. And I just couldn't imagine not being able to be with them during the treatment. But that's what's going on. Number 4, NAMI is the best resource I came across in everything. Like Mary said, they have support groups, and the people that help coordinate the group have some handouts if anybody needs it. There's support groups a couple times a week. There's also a support group for individuals living with mental illness. It was very, very helpful to educate myself with what little we do know. Like, I loved one mom who said, "This isn't a casserole disease." And we were all like, "What do you mean?" You remember that night? She said, "I have a child with, I think it was kidney disease, who had to go to the hospital, and everybody brought over casseroles. And then their son, who's schizophrenic, was lying in the yard and had to be taken to the hospital, and no one brought a casserole over. No one." So, and it helped me realize that I'm a separate human being. I'm not him. So when there were psychotic episodes or really scary stuff, I could separate myself to some degree. So that was super helpful too. I can't say enough good things about the National Alliance on Mental Illness. They're very, very important to many, many of us. Number 5, that recovery is a process, and sadly, relapse is a part of it. I just learned something new in the last 2 weeks. There's a thing called PAWS, post-acute withdrawal syndrome, because I sent my son to a $25,000 treatment program, got him off heroin, and then he was fainting and sick, and really, he said, "I feel worse than I ever have." And Dr. Dubin said, "Oh, they didn't tell you about PAWS, post-acute withdrawal syndrome. For some people, when you take the heroin away, it's your brain is screaming for it, and you just get sicker and sicker." And so it's like, I can't believe the $25,000 place didn't mention this to me, that this could happen. So all these surprises just keep happening. I see people nodding that have been through this. That every experience is unique. There will be loads of experimenting with therapists, psychiatrists, medications. One person, like at NAMI, would say, "Oh yeah, the very first thing they did, their child was in good shape," but it definitely isn't that way for all of us. That some days they're the real Joe, and some days they're afflicted Joe. So you kind of got to know how to communicate with your loved one. So that was a real learning experience for me. That another one, number 8, lots of people have lots of ideas about how I should be dealing with Joe. Thank you very much. I just keep going step by step. I learned, number 9, patience is a virtue. I'm stronger than I ever thought I could be through this. And that to celebrate small victories. I want to read you what he wrote me for my birthday earlier in September. "Mom, we sure have gone through a lot together, a lot of downs, but the ups more than make up for it." Okay, I'm questioning that part of it. For 26 years, I've had the privilege of being your son. You've taught me so much. You've helped me through tough things I was convinced couldn't be done. You're always there for me. To put it simply, I'm a better man because of you. Thank you for being a living embodiment of the idea that you don't need everything to be perfect to be happy. So you got to celebrate the little steps, but that's my top 10 takeaways from being a mom to Joe. Thank you.
I'll take a little different tack than some of the others do, and what you've heard before too. I'm a Republican. My name is Jeff Jensen. I've been working in politics 15 plus years, been involved very heavily at the county level, and I voted against this last time and the time before. And I'm voting for it this time. And that surprises people. And they say, "Well, why would you do that?" Over the last couple of years, over, Laurie, how many? 30, 40 meetings that I've been to over the last year, I've been convinced that this is done correctly this time. Well, what does that mean? Well, what was missing last time? This was missing last time. What's this? Well, you all can get this. LarimerCountyMentalHealth.info. This is the master plan, ladies and gentlemen. When I go into an issue, I have to look at several things. One of those things is there a problem? Is this a solution looking for a problem to fix? Well, clearly, it's not. I think everybody in this room probably understands to some degree that there is a crisis in this country, in Larimer County. This is not a failure on the part of society or parents or the system. Private industry has done a really good job. You guys have done a great job, but there's holes in that system. And that's called continuity of care. You've heard a couple people say that. What does that mean? Well, Curtis, I didn't have to promise I wouldn't swear, but my wife came with me, so I'm still on the hook here. I'll tell you a story. My wife, Amy, had breast cancer 13 years ago. And when we talk about continuity of care, what was really important for us, and we were blessed that we had that here in Larimer County. And it was before the cancer center, because after her treatments, we became very involved in that cancer center. But what does it mean to have continuity of care? Our primary doctor lives in Fort Collins. The oncologist lives in Fort Collins. The tests that were needed were done in Fort Collins. Her surgeries were done in Fort Collins. Her radiation was done in Fort Collins. All the aftercare was done in Fort Collins. That's not true in this world. Curtis explained that. There's nothing more important in whatever challenge that you're going through. In care, there's nothing more important than that continuity of care. And when we have to send a family member, like we did my grandfather, from Buffalo, Wyoming to Minnesota, how horrible is that? For someone like me, it's really important that when I give my money to my government, I expect them to have accountability, transparency, and oversight. I didn't give my daughters $100 without finding out how they were going to spend it, right? So let's talk about the accountability. There is in this master plan, the Behavioral Health Policy Council will be a system of folks who will come together from all of our communities here in Larimer County and watch what this mental health facility is doing. How are they spending the money? What are they doing with it? What's next? Are they watching the mission creep, or are we right on task of where we need to be? That's important. It's important that every community in Larimer County have the opportunity to have that voice, right? Transparency. Larimer County is very transparent in how they spend their money, and this isn't going to be any different. This policy council will make recommendations. This policy council will provide those recommendations to the Board of County Commissioners. The Board of County Commissioners on an annual basis will look at the budget and approve the budget. That's the oversight. Those things are important to me, and they're important to a lot of people on both sides of the aisle. And that's why I'm a little bit confused at times why this has become such a partisan issue. It shouldn't be. It's not a matter of what side of the aisle you're on, how old you are, how young you are, what color you are, what religion you are. This gets everybody. And so I've come out quite vocally in support of this, at the expense of a couple of friends that say, you're an idiot. I say, well, I'm willing to admit that, if that's true. I don't think it is. Folks, we need to pass this. 97,000 people voted against it. 90,000 for it, if I get those numbers right. What does that mean? It means we need to talk to 3,500 people that will change their vote, right? And swing it. And I think that's a doable thing, because I think there is a crisis in Larimer County. I believe that. If you're 18 years old to 40 years old, there's a crisis there. Men are killing themselves. In Larimer County, Colorado, this is one of the most beautiful places in the world. Look at the awards that are given in these communities all over the place. And people come here and kill themselves. You guys, I'll challenge you. I'll challenge you very strongly. Doesn't matter what your neighbor is, who your neighbor is, what their political bent is. Talk to them. Tell them what this initiative is all about. Send them to this website. Lori, I don't know how many pages this is. I didn't count it, but that's, if you look at it, I've highlighted, I've gone all the way through this thing many times. The information's out there. And for many of us, what's important is that we do something that's needed. Not just do something. That's kind of our political bent, right? Oh my gosh, there's a crisis. Just do something. And sometimes we get caught up in our own ideology, don't we? But ideology, when it collides with pragmatism, that's called governance. I believe the governance in this has been put together correctly. I believe the oversight, I believe the transparency, and I believe the accountability is in this. And it doesn't matter what side of the aisle you're on. I think we're all on the same page when it comes to looking at our government and say, do something. These are pieces that we all expect. Thank you.
So Greeley does have an inpatient substance abuse treatment program, and I think that's what the question was referring to. A person can go to detox, but currently the waiting list for the True North inpatient program is 3 weeks. So it's almost impossible unless a person gets on that waiting list, does the initial assessment, and then once their bed date comes up, then if they need to go to detox first, and then they can move right into treatment. But most people go to detox, and then unless someone has insurance or the ability to pay for another treatment program, then they come back out and they can't go right into treatment. So there's a huge delay in continuation of care or continuity of care.
Will the majority of this tax go toward treatment of those who need detox or have a drug addiction? From my perspective, I would say no. It's going to be more of a balance. And we're going to identify what the population needs. But it's not exclusively detox, or even more so detox than anything else. Does any of the panelists want to respond to that?
I think the biggest thing to think about is so many people with substance abuse issues also have a mental health issue. So it's the ability to treat both. A person can be detoxed and then move into the ATU unit and get their mental health needs addressed. And so for years in this field, it's like, well, what do we treat first? Do we treat the substance abuse issue or the mental health issue? And those treatments were always separated. The mental health treatment would be like, well, we're not going to treat them until they get sober. And the substance abuse treatment programs would be like, well, we want them stable on their meds and have their mental health treatment addressed before we can meet their needs. This is something where it can address both of the co-occurring issues. And so having an ATU and a detox together is just imperative in most people's care. This is not the exception, this is the rule.
I also want to point out that there's a lot of discussion about what happens once someone's in treatment. But one of the real keys to this is the outreach. During the first 2 years while the tax is being collected, while we are saving the money to build the facility, there will be a concerted effort in outreach. Telehealth. You know, we have technology today that some of these things could be addressed remotely. I have a brother who's been in that field with the VA for many, many, many years. It is amazing what can be done. So don't get hung up in the fact that we're building a building, because a lot of what we're going to be doing with this money is outreach and education. So please keep that in mind as you move forward.
Next question. This is for Jeff. How can we change the HIPAA law so that parents of adults with mental health addiction can communicate with the hospitals, etc.?
Laws are done in our legislature. If there's a political will, if there's a public outcry, if there is needs to do that, the first thing you do is start reaching into your representatives. Can't do that at city. Those are federal regulations that we deal with. And so they're very difficult to change. That doesn't mean they can't be changed. But if those are the things that need to happen, then you need to get involved. Oh God, that's scary. Yep, it's scary. But you gotta do it. It's the only way things get done. You call your congressmen, you call your senators, you talk to them, you write them letters, you make sure that they know that you're there. Squeaky wheel. Okay, so that's how you get things changed that way. There is a budget in this master plan. Look at the numbers, look what they mean. Larimer County already owns the property where this building will be built. That's a huge chunk of change that we don't have to come up with. Depending on who you ask, who, 4 million to 14 million, right? So Larimer County has been responsible in coming out and saying, we're going to take the lead on this. If you don't mind, you just give me a couple more minutes. Larimer County has always been innovative. And that's another reason why I think you can trust this initiative in the hands of the oversight in Larimer County. Gary, I don't know if you were at the meeting with the Larimer County BOCC, the admin manners meeting, when the folks from Community Corrections came in and talked about the gardens. Were you there? Community Corrections is an incredible program that we have in Larimer County, and has been very successful. So successful that people look from all over the country back to Larimer County and say, teach us how you do that. Well, if they can do that there, I think they can do that here too. I was in a meeting, an admin matters meeting with the Board of County Commissioners, and they had a couple of young ladies there, both from Denver. The one young lady spoke up and she said, you know, I've been trying to get into this program, and I finally got accepted. You guys saved my life. She said, I know there was a God, I just didn't know he lived in Larimer County. So there's innovation in Larimer County. We have great people that think about these things and understand what it means to do this. And I think that we as a community can look at this oversight and say, yes, I think we'll build a world-class facility, but we'll save lives and we'll do what's right.
Thanks, Jeff. Just to clarify, I am a member of the Citizens Advisory Committee, and in such a role, I can also advocate for you to support this initiative. Next question. How will the advisory committee be selected? What will be the criterion used? Is that something that Lori can answer?
Good evening, Laurie Stolen. I'm Behavioral Health Project Director for Larimer County. So the Behavioral Health Policy Council will be under the guidance of the Board of County Commissioners, like the Planning Commission and many other boards and councils that they have. They felt it important to have municipal oversight of the dollars that will be spent through the distributed services that will happen around the county. And so they have the bylaws that have already been written and approved by each of the mayors around Larimer County. And their plan is to have a 12 to 15 person policy council made up of the mayors and or their designees, and then some at-large community members. If you're interested in being on the Policy Council, it will be open for application. And then the commissioners will appoint those folks to the Policy Council, and they'll have terms just like, regular bylaws to any kind of a board. What's unique about this Policy Council is the commissioners are aware that if they have behavioral health specialists on this council that may also be an agency that may benefit from increased funding to increase capacities, that there would be a conflict of interest, and they didn't want to create that. And so they were very purposeful in defining who would be voting members of this Policy Council, but to also have the expertise of our behavioral health specialists in the communities. They've created a special technical advisory committee, a TAC, that would be appointed to reporting to the Policy Council itself. And so you get the best of both worlds, the behavioral health specialists not necessarily having the voting rights, but having input and making recommendations on where the dollars can make the most impact so we can get the best return on investment, where we can get some real immediate returns from funding community service providers around Larimer County, and then this Policy Council that will make recommendations to the commissioners. We had talked about the Policy Council being a deciding body, and what we found statutorily is because it's a sales tax, it's taxpayer dollars that will be running the programs, that the Board of County Commissioners can't delegate their fiduciary responsibility. That would be illegal. So really what they want is the experts in this Policy Council to be the ones to make the recommendations, and then they would simply take a role of ratifying those decisions, and then we would make it happen in the community.
What entity will be handling the money? The county will collect the dollars, and they will be working with the various advisory committees and be funding the providers of services. Will there be a connection for people who are homeless and mentally ill, but they appear all right? How can we get people to help?
So there's a number of agencies that are involved in helping the homeless in our community, and we interact with a lot of them. The Homeless Outreach Program is one that helps us engage patients, or vice versa. When we see patients, help engage them and get them into services. We have the MAC team that are high utilizers with Medicaid. Summit Stone. So we get connections with a number of agencies that are already working with the homeless, and so it's always a high target population that we're trying to help, and also high utilizers that we see often coming in multiple times wanting detox. And then at some point, how do we get them engaged into treatment so they get better and they can break that cycle and get some stable housing? The Murphy Center has been wonderful. We work a lot with the Murphy Center. Housing with Red Tail Ponds. I mean, there's so many agencies that are involved in this that we try to utilize every resource we can. And so, again, it's really difficult for a person who is homeless to get sober, to get into treatment, to make improvements when they don't have a stable place to live. So there's just been many things that we have done, but many more things that we need to do. But it's a collaborative process by all means with that.
Just to address this question just a little bit further, I mentioned earlier that Larimer County has a contract with Summit Stone to connect people to services. The key to that is the case management. There's no insurance, Medicaid, or anything else that'll pay for case management time. So we have to pay for that out of something else. So that's the key to keep people engaged, is that we have caseworkers out there looking for them and bringing them to treatment, talking them into continuing their treatment. So that is part of that. Lori brought up the co-responders grant. If you don't know, we just got that grant a couple months ago, 3 months ago, I guess. Lori's the project manager on that grant. Fort Collins Police Services, Larimer County Sheriff, and Loveland Police Department, we went together and put together a grant and got it to have mental health workers that go with law enforcement on calls involving people with mental health problems or substance abuse problems, as far as that goes. We got $1.4 million over the 3.5 years for that.
Mr. Jensen mentioned having to save money before the facility can be started. When do you anticipate the facility will be built?
So sales tax revenues, if this passes, would start coming in February of 2019. We would begin immediately with the Behavioral Health Policy Council in defining funding priorities for the distributed services portion of the budget to start going back out into the community, that early identification, early intervention, really trying to get upstream from crisis, building those partnerships with our school districts, with our child advocates, with suicide prevention training and curriculum, gatekeeper training, et cetera. And along with that distributed service funding, the plan is to collect sales tax revenues in the first year, most of it in the second year, and then whatever's remaining in the third year. I don't know if you know much about the construction of large-sized facilities, but there's about an 18-month to a 2-year design and then build plan for that kind of thing. So the goal would be to start and design and build, design at the very beginning, and then the build at the end of the second year, and it would open in the first part, we're hoping first or second quarter of 2021. The emphasis, though, is that the dollars that will be collected wouldn't have to wait until then to start to be spent and for the communities to start seeing some of the benefits of this initiative because of the distributed services component of the project.
Fred and others, can you speak to the difficulty of attracting psychiatrists and other prescribing experts to Larimer County? It's well known that there's a shortage of physicians in general, psychiatrists in particular. It's just not a Larimer County issue. It's issue statewide and indeed nationwide. The Summit Stone Health Partners is doing a lot of telemedicine now, working with psychiatrists long distance because that's the way that it's working right now. But it's difficult to get psychiatrists here. The intent of increased resources in the county is that'll make it easier to attract psychiatrists and others to get here. Why is it important for the county to own the building and maintain the building? Who will hire the third party providing services?
I think that really kind of speaks to some of the confusion on this 1A also. People think that it's a growth of government. Well, it is. But there's also the thought process out there that says Larimer County is going to take this over and there won't be any room for private industry. There won't be room for our nonprofits. That is not the intent. In fact, part of this is developing those public-private partnerships so that private industry can come in with their best practices and do what needs to be done here. Larimer County is going to own that building. Larimer County is going to be the hub of that activity here, working with 1, 2, 3, 6, 8, I don't know how many. We'll determine that when it comes time to send out those RFPs, the request for proposals, that says, okay, Summit Stone, you have a chance to bid on this. UC Health, you have a chance to bid on this. It could be anybody anywhere around the country that says, you know what, we see an opportunity in Larimer County that a need needs to be met. And you know what? We have the ability to do that. This is not something that's never been done before. San Antonio, Texas is already very successful at that. So please keep in mind that this is not about Larimer County owning all of this. This is about Larimer County being a convener and a hub that says this is where we're going to go. This is a 20-year tax that could end. It could actually end early. It could be reduced. That's the oversight that the Larimer County Board of County Commissioners has. And the expectation when these RFPs go out are going to be you, Mr. Whoever you are that's coming to Larimer County to be partners with us. We're going to expect that you look at sunsetting that. There's going to be a 5-year plan, a 10-year plan, a 15-year plan. These are the places that you need to meet, the goals you need to adhere to, so that we can look at that That doesn't mean it doesn't continue. It may. 20 years from now, a lot of things can change. There's a lot of ways to get paid for this. This is not about us paying for all of it. Insurance will still cover, Medicare, Medicaid will still be covering some of those expenses, but we're going to expect that our partners are looking for ways to be innovative, but also looking for ways to create their own funding sources, continue those funding sources. So we'll own the building up until the point that somebody says, you know what, we're done with this, and somebody needs to buy the building or whatever they want to do. But that's down the road a long ways, and we'll get to that bridge when we get there.
I mentioned in my opening comments that the intent of this initiative is to work with existing services. The intent is not to replace the services. If the agencies, organizations out there are providing effective, valuable services, the intent is to expand their capacity to serve more people. Please clarify, how will all the areas of the county be served? Services will be available countywide. The building itself, since the county already has the land, but it'll be accessible from Fort Collins, from Loveland, perhaps Estes. The idea is to find ways to outreach to all the communities in Larimer County and act as a spoke on a wheel to bring people in to take services out. It's not just for Fort Collins, it's not just for Loveland and Fort Collins. The intent is countywide. The question is directed to Gary. How will it benefit law enforcement when this initiative is passed? And what will change this time around since it failed in 2016?
Okay, as far as the benefit to law enforcement, there won't be an immediate impact to empty the jail out with people that have these issues. That's probably not going to happen. I mean, they're there, they're charged, they're going to have to go through the process. There are many diversion programs that we could implement that are going on all over the country. I was reviewing one this afternoon that was diverting people with heroin addiction, those types of things, to programs to get them out of the criminal justice system and get a felony charge off their record, and hopefully they don't become recidivists and back in the criminal justice system. That's one thing. Law enforcement has a hard time trying to figure out where to take people. Where do I take this person? They did something minor, I can charge them. I don't really want to because under the influence of something, I know they have a problem, but I can't get them in the ED. I can't get them to another treatment facility. So, you know, what am I going to do? It's the jail or the ED most likely. And if they go to the ED, they could be there an hour. You know, if you're going from Loveland to McKee or Loveland to Banner, you're going to be there a while until they get them checked in and make sure they're stabilized, not going to be combative. So that takes a lot of time. My understanding is with the new facility, there'll be a medical screening in the facility, so law enforcement can come there, drop them off, they'll get screened and on the road in 10 minutes. I will tell you that in San Antonio, they did have a problem with that. It was taking 20, 30 minutes to get people checked in. They got that down to about 10 minutes. So law enforcement could take that person, they could be safe there, they're going to be taken care of, the officers can get back on the street and do the jobs they should be doing. That's one way it's going to help. It's going to help the entire criminal justice system if we can get people diverted from charges and into treatment where they should be. And I can tell you that the chief judge has already indicated that he will use this rather than incarceration in many cases because they see so many people. And I will tell you that we have issues with the Department of Corrections. Most places in Colorado, community corrections, have people that are diverted from prison to them, about 50% of their capacity. The other 50% of their capacity are transitions from the Department of Corrections to community corrections. Most of them, like I said, are 50-50. The courts here recognize that the treatment can occur in these remote locations. They can't get treatment providers there. So we're having to take up the slack in Larimer County. We're kind of victim of our success. We have 75% of the people in community corrections in Larimer County are diverted from DOC to Larimer County Community Corrections because they get the treatment they need and are successful. Our success rate is 70%. Statewide, it's 50%. So we get people through the programs. We know how to do that. So will that play into this? Yeah, because I'm sure there's a lot of people that we deal with that are going to be seeking treatment here. So that's my take.
I mean, that's the million-dollar question, isn't it? How do we get it done? How do we get people to pay attention this time? Well, after the last one failed, and I think it was a big surprise for some of folks that were inside on that, because it's been in the 5-year strategic plan in the Larimer County since 2013. It's been one of those items that has been identified year after year in our citizen surveys that we needed to do. And then all of a sudden, it failed. What's up? So there was a lot of work done to try and figure out why. Well, several things rose to the top. One of them being important is that folks just didn't feel that, didn't understand it. What are we doing? I don't understand the issue. It wasn't that they didn't understand that there's a crisis, I think, in a lot of ways, but they didn't understand what Larimer County was going to do with it. There was no specificity in that plan that said, this is how we're going to spend the money, this is where we're going to put it, this is what we're going to do with it, these are the outreaches that we're going to do, this is how we're going to integrate with our law enforcement, and this is how we're going to integrate in our public-private partnerships. That message needs to get out this time. That message needs to resonate, and it will, I think, if we get that out there. You know, there's a lot of kumbaya, you know, and I don't mean to be flippant, okay? There's a need, I get that. But there's a body of people in Larimer County that will never vote for a tax no matter what you do, and we're not going to change their minds. But there are those like me that say, show me, prove it to me, show me that Larimer County can be responsible with it, put a sunset on it, be done with it, and tell me how you're going to spend the money. And you make that case, and I'm willing to come around. And there are a lot like me, believe it or not. And I really think that the message out there that says we can be responsible, we can be accountable, we can be transparent, and we'll provide that oversight. With that messaging, with those folks that, like me, will say, that has to happen, or I'm not voting for it, I think we can win this thing.
Out of the 180,000 votes, 2016, we lost by less than 7,000. So I wouldn't totally call 2016 a failure. I would say that we made some progress and we learned some lessons.
Good evening. My name is Gil Borrella, and I'm the campaign manager for the Mental Health Initiative for Larimer County. You have a great question because I would say in this room, about 95% of you are for the Mental Health Initiative. You'll be voting yes. So we're actually, tonight, we're kind of preaching to the choir. We need to get out to the people that did not vote for it or came out to vote against it. And the reason, that's what we're doing with this campaign versus the last campaign. This campaign, we have teams of people that are calling up until 9 o'clock tonight. They're calling your home. And we have those people that voted against it last time or didn't vote with us for obvious reasons. And we have people, teams of people that are calling homes every night until election night. They will be calling them I have a program that we set up, and we have a virtual phone bank, and people sit and they make phone calls all night long. They will be walking and talking and knocking on doors and talking to the voters. The way that you get people to vote for this is you have the golden rule is to get direct voter contact. You need to get with those people and you need to talk to them. Before we ever came and before the commissioners actually voted for this, I was actually advising the county on this project. So here's what we do, is we started working with the voter contact. We started directly not actually talking to them about voting, but we talked to them about this initiative. Why did it fail last time? How come you didn't vote for it last time? What went on? Are you interested this time? And people started leaning our way. We did a poll before this all came out. And we talked to voters about how they were going to vote, if they would get the vote again, if they would be able to vote again. And people started again favorably and started moving our way. And we started convincing them and attempting to convince them of this is the way we need to go. These are the reasons. With Lori's direction, we used some of her data that she had. We started using that, and it's national data. We started talking to them. Then we started. Once the commissioners then went into said, okay, we're going to put this on the ballot. Then we started going, okay, now we want to vote on 1A. So we started moving that direction. This week we started really hitting them and telling voters, hey, we need your vote. This is what we need. All the way up until the ballots will come out on the 16th of October. We will be then chasing ballots after that. If people have not turned in their ballot, if you turn in your ballot first, your name comes off the list, and you can guarantee you will not receive another phone call from me. If you do not turn in your ballot, and the longer you hang on to it, you'll continually get phone calls from us. Did you turn in your ballot? Here's how we'd like you to vote. And we will convince you. We will attempt to convince you to vote. Now, as Jeff said earlier, there's going to be people that want to vote against this, and they'll never vote for it. Those people, they won't get one phone call from us because we hope they forget to vote. So that's the way we work this. And this year, it's different. This year, we're talking outside of these arenas, and this is great, and it's good information for people, but we also need to get to the people that are maybes and the no's, and some of the no's, that were leaning our way the last time. And that's how we're going to do it this time. And we will be successful.
Quick follow-up,
Okay?
if I may. And from a political standpoint, don't you feel, and have you addressed,
Just say it into the microphone.
don't you feel, don't you feel, and haven't you encountered this, that people look at this issue as a weakness on the part of the people that need it? And they see it as, hey, if you can't pull yourself up by the bootstraps, don't ask for my money to do it. Now, as you pointed out, illness is illness. But how many people understand that? How many people have this preconceived notion? And have you addressed that part, or is that not really a part of this?
Stigma is a very huge part of this. It's something that Lori has been working on for 3 years. I know Michael Ellen and his staff at Summit Stone Health Partners has been centered to what they do. It's been part of my career for 40 years. We need to educate people that mental illness and addictions are a disease. That's been proven by the National Institute on Drug Abuse, the National Institute on Mental Health, the National Institute on Alcoholism and Alcohol Abuse, the medical centers, National Institute on Medicine is what I'm trying to say. All these organizations have done research going back to the 90s. The early 90s, and they've demonstrated in research after research after report after report after study that these are diseases. Something changes in the brain. And we have to educate your neighbors. We need to educate our coworkers. We need to educate the PTA. We need to talk to our kids about it. These are diseases. It's not a moral weakness.
In observing it this time versus last time, I will say Lori's made a big difference, working hard on it for the last 2-3 years, educating. The mayors have all come together and done some spots which didn't have, I mean, there's so many things that are happening differently this time, because I think Loveland really lost it for us last time. And there's been a concerted effort to make sure that Loveland people are being educated and talked to this time. So I see a lot of differences this round.
And Lori, how would people get a copy of the master plan?
There are 2 different websites that you can get access to this book. Electronically, it's much easier to use than hard copy. All of the endnotes are hyperlinked to get to the actual resources and references. The table of contents is live, so you can just look down the table of contents, a certain section that you want, and you click on it, it'll take you right to it. And so in this, you can find a lot of answers. And then if you don't get your questions answered, you can email me. The website to find it most easily, right on the front page of the website, is larimercountymentalhealth.info. larimercountymentalhealth.info. And the Citizen team also has a website it's available on there as well, and that one is Larimer County Citizens for Mental Health Matters.
My name is Jody Shattuck McNally, and I'm the treasurer for Larimer County Citizens for Mental Health Matters. And I've been out the last couple of months doing pretty much a presentation a day, anywhere from Estes to Bertha to Loveland, Fort Collins, and we've had some really great responses. I am asking you, as a treasurer and getting out and talking with voters, to please go home tonight and talk to 5 to 10 of your neighbors and friends who you think is maybe on the fence. Not your friends that you know will vote yes, but your friends that you think will be on the fence. There's a great video that stars my friend Fred here that is on the Larimer County Mental Health Matters Facebook. And I ask you to take that video and put it in your emails or share it on your Facebook. And I believe people see that video and they understand the need. This will help. So I ask you to do that for me. Thank you.
At this point, I really want to thank you for your interest in this public health issue. Thank you for coming tonight. Even though I've been in the field for 40 years, I learned some things. Good night, and we'll see you at the ballot box.